Welcome to the recorded version of Alzheimer's and Wandering, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care. Okay, our presenter today and every month is Lakeland Hogan. Lakeland is a gerontologist and caregiver advocate for Home Instead Senior Care. She works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. And with that, I would like to turn the presentation over to Lakeland Hogan. Welcome, Lakeland, and thanks for being here.
Thank you so much, Steve. Hello, everyone. I hope that your day is off to a good start, and I hope it's warmer wherever you are than it is here. I think we're in the single digits in Nebraska, so wishing you all warmer weather than that. But anyway, I want to thank you so much for tuning in today. We have a topic that's one that I get tons and tons of questions about from family caregivers, from professionals, and that's Alzheimer's and wandering. It's also, unfortunately, a topic we're seeing more and more frequently in the news and on social media. And with this cold weather that we're having in Nebraska, maybe you're having where you are, it's even more important that we talk about wandering and how to prevent it, because these freezing temperatures or extreme temperatures can quickly make wandering situations one of life or death. However, there are many things that families can do to hopefully prevent wandering and things they should do if their loved one goes missing. And we're going to talk about all of this today. So I'm going to get us started with the objectives. We'll start by identifying potential signs and triggers of wandering. We'll also understand why individuals with Alzheimer's disease or other dementias might wander. And then we're going to identify ways to prepare the home and to prevent wandering, and then also learn what to do if a person goes missing. So I love to always start out with a few statistics to give us an idea of how prevalent this issue is. Home Instead Senior Care conducted a survey with family caregivers, and we found that about 46% of caregivers in North America that are caring for someone with Alzheimer's or dementia reported that a loved one has wandered off or become lost. And nearly 1/5, or about 17% of these family caregivers, called the police to find their loved one. And in addition, 71% of those family caregivers were taking precautions to help prevent their loved one from wandering or getting lost again. So while these statistics are the survey was a little alarming, a lot of people are experiencing this, it is encouraging to know that caregivers are taking precautions to prevent wandering in the future. And we're going to talk more about the prevention side later on in today's webinar. But let's see how this survey is in line with some of the national statistics. According to the Alzheimer's Association, 3 out of 5 people with dementia will wander at some point. So we know, again, this is a common issue. And oftentimes, law enforcement gets involved with the search efforts and in the event that someone goes missing. And there's an expert in the law enforcement arena who works for the San Diego County Sheriff Department. Her name's Kimberly Kelly Faulkner, and she's developed this program called Project Far From Home. And in her report, she said that in urban settings, more than 25% of all missing persons that come to the attention of law enforcement have Alzheimer's or dementia. So 25% of all missing persons in her specific area again, have some sort of Alzheimer's or dementia. She also says that most individuals wander multiple times, with anecdotal evidence suggesting that they'll wander 6 to 8 times before a family caregiver recognizes their behavior as wandering or recognizes the dangers of wandering. So I want to spend a little bit of time on that last bullet and kind of clarify a little bit. So I want to give you an example. So let's say a caregiver walks into the house and can't find their loved one. They start to search in the normal rooms where they are most of the time. Maybe it's the living room, the kitchen, the bathroom. And when they're not there, then they start to search those non-frequented areas of the house, and they may start to panic a little bit. But then they look outside, and they see that their loved one is just in the neighbor's backyard. So while this is a relief to the caregiver, this would be, I guess, what we could consider a wandering event. Now, we didn't have to call 911. We didn't have to call out to all the neighbors to help us find the individual, but the person wasn't where the caregiver thought they were going to be or expected them to be. So these types of maybe less severe or not as alarming wandering incidences occur about 6 to 8 times before a caregiver realizes that there is a true problem and starts to acknowledge that there are some potential warning signs, and maybe it's time to start putting preventative measures into the home. So as professionals, if we can educate family caregivers about signs that their loved one might wander, some triggers, then hopefully we can help families put those precautions in place far before their loved one wanders off 6 to 8 times. Hopefully it only maybe happens once, and then they start to put precautions into place, or maybe we can prevent wandering from occurring in the first place. But I'm sure that statistics like this leave family caregivers wondering, why is it so common for someone with Alzheimer's to wander? So I want to talk a little bit about these whys behind wandering. So we know that when it comes to wandering, it's important for caregivers to understand that generally there's always a purpose or intent to the wandering. It's really just a matter of identifying the potential triggers. So before I dive too much deeper into the whys, I would just want to take a quick step back. If you're unfamiliar with Alzheimer's or another form of dementia, I would suggest doing a little bit more research, maybe going to the Alzheimer's Association's website. But from a very high-level perspective, Alzheimer's disease is a result of damage in the brain, and it's generally believed to be caused by plaques and tangles in the brain. And this damage affects the parts of the brain that are responsible for a person's memory, thinking, and behavior. And as a result, people living with Alzheimer's or related dementia may become disoriented or lost, and they may even become disoriented in their own home or their own neighborhood. And for those that do not have a diagnosis of Alzheimer's or dementia, if they start to wander regularly, this could be a sign that they need to visit their doctor and get screened, get a dementia screening. Again, because that could be a sign that their loved one is developing dementia. So the impairment that causes a person to become disoriented or confused and causes them to wander, but they're not typically wandering around aimlessly for no reason at all, as I mentioned earlier. There's generally some sort of purpose or intent behind the wandering. So I want to give you a couple examples. So you see the gentleman on the slide. Well, that is Stuart. And on this particular day, he arose early, ready for a new day, and excited about the prospect of going to a job that he loved. He put on his favorite suit and tie and headed out the door with his briefcase in hand. He was ready to dive into his daily duties as an insurance adjuster. But in reality, Stuart is 85 years old and has been retired for 20 years. He also has Alzheimer's disease. This brain disease has taken him back to a different time and place. It's disoriented him. It's confused him. And the intent behind his wandering behavior is that he thinks in his mind that he has to get to work on time. So that's why he put on his suit and got out the door at 8 a.m. just like he does every day. Another example is that someone may have an unmet need. And we're going to talk more about these unmet needs when it comes to someone with Alzheimer's or dementia. But perhaps the person has an unmet need of needing to use the restroom, but maybe they're in a different environment than they're used to, or maybe they don't recognize their surroundings and they wander off trying to find the restroom. But despite the reasons for wandering, there are dangers that accompany wandering, especially if the person goes searching for something and gets lost. And due to the confusion that individuals with Alzheimer's might have, they are often unable to ask for help, which leaves them vulnerable to weather, traffic, and those that prey on vulnerable individuals. And sometimes the term wandering can be a little confusing because, again, the person is not likely to just be wandering about aimlessly. There's generally a purpose or an intent behind the wandering. And sometimes it even looks like they look like a person on a mission. I'm sure Stuart walking down the street looked like he was on a mission to get to work. So to the average individual who might not be familiar with Alzheimer's or dementia, if they were to encounter somebody who was wandering, it might not be apparent that they are in the wrong place and that their family members don't know where they are because they've wandered off. And then one last thing to note when we talk about the whys behind wandering is sometimes wandering is not always harmful. In fact, for some people living with the disease, the purpose or intent behind their wandering is more of a therapeutic intent. Walking around might allow for exercise for them. They might like to get out and enjoy nature. And they might like to wander around and talk to other people, interact with the world. And these aspects of wandering could actually be helpful in reducing the depression, which is commonly associated with Alzheimer's. But the key is, if a person is wandering for a positive benefit, we need to make sure that they're in a safe environment for wandering. And again, we'll talk more about this later on. So when we talk about the whys behind wandering, generally they're disoriented. Generally there's an intent behind it, and for some it might be therapeutic for them. But there are some common triggers that families can be on the lookout for, and they can kind of get to know about their loved one over time. So let's talk about those triggers. As you can see here, there are many common triggers for wandering. And Alzheimer's disease affects everyone a little bit differently. So caregivers will want to do their best to decipher potential triggers for that particular individual. And then if they can, they want to document the wandering events to see if they can identify patterns and then try to get to the root of what is causing these triggers. So the Alzheimer's Association identifies the first 5 common triggers that you see listed here on your screen. The first is disorientation to place and time. We talked about that quite a bit already. But oftentimes, in relation to this disorientation of time and place, someone with Alzheimer's disease or another type of dementia, they're frequently asking if they can go home. And this is often because, again, they're disoriented to the place and time. They may not recognize that they already are home, or for that person, their reality might be their childhood home or the family farm. Those places are home to them at this point in their disease. Also, if the individual ends up in a crowded or busy place, it can sometimes cause confusion and disorientation. So if the person is feeling overwhelmed in that type of a situation, it's best to remove them from the crowd if possible. And in general, when someone is confused or disoriented, we want to refrain from correcting the individual and reassure them that they are safe. For example, if they keep saying that they want to go home to the family farm, it's not going to get the caregiver anywhere if they try to tell them, well, the family farm no longer exists. We sold it 20 years ago. Don't you remember? Because to that person, the family farm is home to them. So instead, you might want to redirect them to an activity that they enjoy, or say, oh, we'll visit the farm later this week. But don't worry, you're safe here with me. Let's do this activity that you love. So that's disorientation to time and place. Another common trigger is a change in the routine. Routine is very important for an individual with Alzheimer's or dementia. To give you an example, one of my clients that I worked with a few years ago had just moved home from a long-term care community. Moved from her home, to a long-term care community. And she was confused about leaving her familiar home and was often found wandering into her new environment in an effort to make her way back to the place that she was most familiar with, which was home to her. So when this happens, it's important to reassure the individual that they are not lost or abandoned. And it's important to put safety features in place to keep that person safe. And I'll go into more examples on these types of safety measures that families can put into place. But when it comes to the change in the routine, if they move out of a community setting, or even if they're in a different environment for a short or extended period of time, we want to try to keep them as close to a regular routine as possible. So if they always take a nap at 10:30 in the morning, we want to make sure that even if they're visiting relatives in the next town over, that they're able to stick to that routine. Because they do, people with Alzheimer's and dementia, they do better in a structured environment. It provides comfort and safety. So again, if they have to make the move from a home to a community setting, something of that sort, we want to try to create the same kind of routine that they had in their old environment. Another possible trigger is delusions or hallucinations. Someone with dementia can misinterpret sights and sounds to be other things. And I had a client who frequently looked out the window because she believed somebody was at the door or on the porch. She was having delusions that someone was there, and she felt that she needed to get outside to let them in or to bring them a coat because they were cold. And she would try to open the door, and a couple times she was successful. So we worked with the family to find a way that we could ensure that an additional safety lock was added, and then also we suggested that we keep those window shades closed most of the time because we know out of sight, out of mind. So we kind of redirected her attention to other parts of the room. So those delusions and hallucinations can cause somebody to wander off. They might be trying to follow the person that they're that they think that they're seeing, or try to get away from somebody that they think is there. Another common trigger for some can be tiredness or fatigue, particularly during late afternoons and evenings. Oftentimes later in the day they're more tired and they can become easily agitated. This might lead to restlessness, pacing back and forth. So if families can find activities or provide an opportunity for exercise during those times of restlessness, it can help to calm the individual down or redirect their attention towards something else and minimize that trigger or that urge to wander off. And again, sometimes walking around in a safe, secure environment can really help to ease that restlessness. And some refer to this as sundowning. Some would say that that's a kind of an older term, but that's kind of that afternoon time where they might be very alert and a little more active in the morning time, but as the day goes on, they might get a little more tired, and this restlessness, this opportunity for wandering could increase. And then overstimulation. We've talked a little bit about this already, but a person with dementia can easily become upset if they're in a noisy or crowded environment. And if that happens, they might try to escape from the chaos and wander off. So it might be a good idea if this happens to be a trigger for the individual to avoid large, noisy, crowded places as possible. So if they're going on an outing to the grocery store, perhaps you avoid the high trafficked times of the day, or look for restaurants with quiet areas that you could sit off to the side. During the holidays, this can become an issue. Or during family gatherings, sometimes it can be overwhelming to be in a big room of people. So perhaps the person with Alzheimer's or dementia can be in a room nearby, and people can come and visit in smaller chunks of people. Just again to minimize that overstimulation. So those are the common triggers that the Alzheimer's Association has out there. And then the Project Far From Home that I mentioned earlier had some additional common triggers: food, fear, frustration, pain, and obligation. So I'm going to run through each of those here a little quickly. So food, that gets back to that unmet need. If they're hungry or they feel that they have an unmet need, maybe it's needing to use the restroom, they might set off in search of it. There's a book that I've read. It's called Spectrum of Hope by Dr. Garati Devi, and she talks about the topic of wandering in her book. She's a physician, and she gives an example of a patient with Alzheimer's disease who somehow escaped from her office before her daughter was able to come pick her up. And they searched, this office happened to be located in New York City. So if you can imagine being a family member in New York City, not being able to find your loved one. There's so many cars, people, shops, stores, so they were searching everywhere. And finally, later that afternoon, they found the woman, and she said, "Oh, I just popped into a cafe for a cup of coffee and something to eat." So to her, She was doing something completely normal. She went off to go get something to eat because she was hungry. But because she has Alzheimer's disease, she didn't realize that it was unsafe for her to be out and about by herself, or her daughter was coming to pick her up. So those types of unmet needs can cause wandering in an individual. Another trigger could be fear. We talked a little bit about this earlier. If they're hallucinating or having delusions, they might try to get away in fear of those, out of fear of those delusions or hallucinations. But for some, you might have heard with Alzheimer's disease or dementia that sometimes they think of themselves at a younger age, often in their 20s or 30s. So they may look in the mirror and see an old man, but to them, they think it's a stranger because in their mind, they're their dashing 20-year-old self. So it could be that a gentleman with Alzheimer's disease is with his wife, but because he, in his mind, is in his 20s, he also thinks his wife is in his 20s. So when he looks at this older woman with him, maybe she's taking him to an appointment, he might become fearful because he doesn't know who this stranger is and might try to escape or try to get back home or to go out in search of his 20-year-old looking wife. So again, that fear could be a common trigger. Another is frustration. Perhaps they're frustrated or upset. It could be due to the agitation or the overstimulation, but sometimes they might take off out of frustration. They're trying to get out and blow off some steam or remove themselves from the situation. I had a family caregiver tell me about her husband. He had early onset, and they had gotten home from an appointment or something of that sort, and her husband bolted out of the car the minute she stopped in the driveway. And she took off after him, and he was still very fit, so she had to run really fast to catch up to him. But when she finally did, she said, "Jim, why did you run away?" And he said to her, "I was trying to run away from the disease." So sometimes, even in the earlier stages, when they are still cognizant that they have Alzheimer's or dementia, maybe they're in that mid-stage where they're starting to have some disorientation, some confusion, they might just be frustrated with the fact that they're losing their abilities to do things for themselves. And if you think about it, whenever I'm frustrated, I know I hop on the treadmill or I get in my car and go for a drive. That's something normal that I've always kind of done to blow off steam. So if that was in that person's nature before they had the disease, it might be something that could trigger a wandering event. And then pain. The person might be in pain. Maybe it's emotional or physical. They might be in search of healing. Maybe they're in search of the doctor, in search of medicine, or they're a person of faith trying to get to church to pray about it, something of that sort. And then obligation. They might feel that they should be at work or cooking dinner. There was a woman who always got restless at about 3 p.m. on the dot, and the caregiver finally figured out that at 3 p.m. every day she saw a school bus drive by, and she was a stay-at-home mom, so she felt that she needed to go pick her kids up from school, so she was restless, wanting to get out of the house, wanting to go pick up her children. She had that sense of obligation. But the caregiver realized if I just redirected her to a different activity during that time, got her away from the window, that trigger wasn't there anymore. So again, sometimes families just need to become detectives and get to the root cause of these triggers. And then finally, a move from a home to a care community, a nursing home, assisted living, something of that sort of memory care facility, that could also trigger wandering. So let's talk about that a little bit more on the next slide. In a community setting, especially ones that are set up for memory support or dementia support, they have a lot of precautions in place to prevent wandering. However, there are some common causes of what communities often call elopement or wandering away from the community setting. And there was an article in the American Journal of Alzheimer's disease and other dementias that talked about some of the top causes for this elopement in facility settings. The lack of effective precautions to prevent elopement, the lack of awareness of the staff in terms of the resident location, and the ineffective use of alarms and devices. And the reason I bring this up is if a family is moving a loved one, these are some questions that they can ask. What is the community's procedure? What precautions will they put in place? And again, oftentimes facilities are, when there's a move to a facility, they are equipped with a lot of these precautions. But in some smaller communities, there might not be a specific memory care wing or dementia support set up in that particular community setting. So it's a great opportunity for families to have a conversation with the staff about this. And back to that project Far From Home, there was so much good information. You should Google that if you have a chance. I have the information at the end on the resource slide. But they said that the highest risk for wandering happens in the first 72 hours of a move to a facility. And this is primarily because the staff is not yet in tune with that person's symptoms of Alzheimer's, those triggers, and the person that has just moved in, the person with Alzheimer's disease, they don't know their environment yet. They're trying to figure it out. Maybe they're trying to get back home. So again, as professionals, we're working with families as they transition their loved one into a care facility, or even into a new residential setting, something of that nature. Anytime there's a move, we need to make sure that families think about maybe having some extra help or support, especially during that first 72-hour window, just to prevent wandering and help familiarize the individual with their environment, help familiarize the staff with the person's behaviors, tendencies, those sorts of things. Again, helping them to identify the triggers so that we can put the precautions in place to prevent wandering. Okay, so we've talked about the triggers of wandering, and a lot of times I get asked, well, how often will my loved one wander? Especially when somebody first gets diagnosed, the caregiver is wondering, how frequent is the wandering going to be? And as I mentioned earlier, Alzheimer's disease really affects everyone very differently, which makes it unpredictable and complicated. And it really does vary from person to person. But because of that unpredictability, it's important that families get an early diagnosis and put a plan into place to help keep their loved one independent and safe for as long as possible. When we think about the early stages, the challenge of the disease isn't so much wandering, it's more about getting lost or disoriented. For example, if you've seen the movie Still Alice, was popular a couple years ago when it came out. Alice was in the early stages of Alzheimer's disease, and she went out for a run. And this scene really stuck with me. About halfway through her run, she became disoriented. She'd taken this route 100 times on the run, but at this particular moment, she wasn't sure how to get back home. Nothing really looked familiar around her. So a similar situation could happen when a person is driving. They may not remember that they were going to a certain destination, one maybe that they've been to every day for, maybe it's work, going to work and have been there, going there every day for 10 years, but all of a sudden they don't know how to get back home. So in the earlier stage, that might be a more common instance of wandering. And as we get into the mid to later stage, this is when often wandering happens when they're trying to seek out an unmet need, or they become disoriented, or they have that sense of purpose. They're trying to get home, trying to get out of a situation because of fear. Those triggers really start to set in. And I actually experienced this firsthand with my parents' neighbor, and this was before I even started my career in gerontology. I was leaving my parents' house and was driving down the street and saw my elderly neighbor dressed in a full sports coat with his hat and cane. And as I approached him, I asked, Mr. Grossman, where are you headed? And he said that he was headed home. And when I pointed down the street to his house, he said, that's not my home. I live on 50th and Center. How much can I pay you to take me there? He thought I was a taxi. And so in his reality, he wasn't living in the home that he currently resided in. It was his childhood home. So again, it's going to vary from person to person. It's very hard to say how often a person will try to wander, but if we can be preventative, then we can hopefully help to minimize the number of times that a person can wander. So let's now shift the conversation to more of the preventative side of wandering. The behavioral symptoms of Alzheimer's disease, such as wandering, can sometimes be very overwhelming for family caregivers. And as many of you know, caring for an individual with Alzheimer's disease or another dementia can be very stressful. And many caregivers lose sleep at night because they're afraid of what their loved one might do when left unattended, or their loved one might wander in the middle of the night. Others have to give up their jobs and social circles because their loved one's now wandering and they can't leave them home alone. So a lot of times family caregivers are left with kind of this feeling of despair, or they're not sure what to do. They don't have the resources to manage the situation. So as professionals, we can help family caregivers discover the resources out there and discover what they need to help keep their loved ones safe. So I'm going to walk through each of these different areas. We're going to talk about being proactive, the steps that we can take to keep a person safe, and then finally we'll talk about how to prepare the home. So when we think about being proactive, it's important to research the options. According to the Alzheimer's Association, everyone who has Alzheimer's disease or related dementia is at risk for wandering. So as long as a person is mobile and can wander, it could really happen any time. And again, it might not just be on foot. It could be in a vehicle or even sometimes in a wheelchair. And families can really start by researching the options. It's important to become educated and to educate their family and friends about the potential for their loved one to wander. Caregivers can also research how to prepare the home, which again we'll go over here in a little bit. There's several low-cost options out there that families can implement to, again, prevent and be proactive when it comes to preventing their loved one from wandering. And it's important that family caregivers track these patterns of behavioral symptoms or wandering. And an example of this is maybe wandering occurs after each meal. And it could be that it's due to the unmet need of trying to find the bathroom. The person can't remember where it is. So if that's the case, if the family is seeing this happen about the same time after every lunch and every dinner, perhaps the family needs to build in a restroom break after each meal. And then record the difference to see if these interventions are working, or these different triggers are continuing to happen after you implement a new strategy. And then it's important that families contact their local first responder sheriff's office. Many families across the country that I've talked to, especially in smaller towns, they've said that they've contacted their sheriff's office, and there's usually some sort of form that you can fill out to alert authorities that your loved one has Alzheimer's or another form of dementia and has a tendency to wander, or could wander in the future. So if there's a fire station in your area, you might want to visit there or look into your local sheriff's office to let them know, again, that your loved one has a diagnosis, maybe even provide them a photo. That way, if there's ever a situation, especially at the local fire department, I know mine is right down the street from my house. If my loved one were to wander, then maybe they would recognize them from the photo, and they're informed. And another tip is to notify family members and even neighbors, especially if you're in a close-knit community, even if you're in a rural setting, maybe the neighbors in your country mile or whatnot. But just to let them know that your loved one has a history of wandering, if you ever see them out and about, to let you know. And I actually found an example of a letter you could write about your loved one and distribute to your neighbors as you see fit. I attended a Dementia Friendly America meeting in Washington, D.C. recently, and the guest speaker was from the Montgomery County, Maryland Police Department, and she gave this letter as an example. She says that people in her county find this helpful, and they use it not only for dementia, but they have another version for children with autism. So wandering is certainly an issue, and a lot of law enforcement agencies across the country are really tuning into this issue. Again, like I said, you're seeing it more on social media, and people are this whole kind of movement is helping to find people sooner. So you can download the slides so you can print that off. I don't expect you to scribble it all down now, but I just wanted to give you an idea of a creative way that families have used a letter like this in the past. And then we've talked about these unmet needs. So when we think about being proactive, we can talk to family members about kind of going through a mental checklist of the person's unmet needs. So let's say the individual is starting to get restless or antsy, starts pacing back and forth. Family members can go through each of these 3 categories and think, okay, is my loved one, are they hot or cold? Is it really loud in here? Maybe the radio is on. Maybe we try turning that off, see if that calms them down. And this graphic comes from a book called Confidence to Care by Molly Carpenter. So I'll, again, include that information at the end. But it's a great quick check, kind of check in with your loved one. So for instance, if you realize that the pacing usually indicates the need to go to the restroom, perhaps you can, while they're pacing, kind of take their arm and say, oh, let's walk this way towards the restroom. It might be that they're not able to remember the word for the restroom, but if you lead them there, it might look familiar to them, and then they'll jump into their bathroom routine. So again, this is just a quick, easy check that families can mentally go through when they're trying to be proactive on preventing wandering. There's another proactive measure that families can take that I've read quite a bit up on lately. It's called sleep hygiene. And there's a lot of research out there. I found one particular study. It's called the Night Aid. But really, I've bulleted out the high points, so you don't have to search the entire article. But sometimes wandering can be associated with poor sleep quality, especially when it's occurring at night. A lot of times I talk to family caregivers who they themselves aren't sleeping at night because their loved one is up wandering. So if we can reduce the amount of restlessness during the night, or reduce the amount of number of times the individual gets up, the less potential there is to wander, and then both parties will get better night's sleep as well. So the whole idea around sleep hygiene is making sure that the caregiver and the individual with Alzheimer's disease keep to a regular sleep-wake schedule. So making sure that they wake up at about the same time every morning and get to bed about the same time every night. This can really help get into that good routine. I mentioned earlier how routine can be so important. Also, reducing the caffeine intake, especially in the afternoon time, can reduce the late night caffeine buzz, and then limiting nap time during the day. I know a lot of times people with Alzheimer's disease or dementia tend to nod off during the day, but perhaps if you try to limit napping during the afternoon, during that time perhaps you could encourage a little exercise or an activity. They could even walk outdoors. The positive side of wandering in the secure environment, get a little exercise during that time. Again, that'll help keep them up and maybe help them sleep better at night. And then increasing their daytime exposure to sunlight. And some studies even recommend light therapy. That's a little extreme, but just making sure that they are able to get a little sunshine, whether it's through the window or taking a nice walk outside or even just sitting on the back porch, again, can help with that sleep-wake cycle, that sleep hygiene. So now that we've talked about being proactive, let's talk about the steps, some more steps that families can take. There's a great tool. It's called the Missing Senior Network, and it is a free online account that you can set up for family and friends and even local businesses to alert them if your loved one were to go wandering. So you can enter their email, their text, or their phone number, and then if the loved one goes missing, they can send out a message, and it'll email them and text them to say, my loved one is missing, last seen at, that sort of thing. So it's a quick, easy way for families to get the word out. There's also the Medi Alert bracelet and the Safe Return program that the Alzheimer's Association has. They offer ID bracelets and necklaces, and if the individual wanders and they're found, the person can call that number, and then that number helps connect them to the family and get them returned safely and hopefully timely. Another good idea is to label clothing. Sew in a little label that says the person's name and lists a phone number. That can help. And then also putting a note in the wallet or taping it to the driver's license. The note could say something to the effect of, I have dementia or I have memory issues. Please, if you find me alone, please contact my loved one at this number. A lot of times when an individual is missing and they encounter law enforcement, what's the first thing they always ask you? Can I please see your identification? So if there's a note or a little card in the wallet, it's more likely that the law enforcement personnel will see that and hopefully help expedite the return home of the individual. And then it's important to keep an updated or current photo and updated medication list on hand. The updated or current photo is helpful because a lot of times when people have a loved one go missing, some of the first questions that will be asked is, well, what was that person wearing? Can you please describe them? And as a person progresses through Alzheimer's disease, their appearance tends to change a little bit. I had one family caregiver who said, I just snap a quick picture of my husband at breakfast every morning. That way I don't have to remember what he was wearing, and I always have a current photo of what he looked like because her husband had early onset and progressed through the disease pretty quickly. His visible appearance changed quite drastically. So that was helpful. And then the medication list, in the event of a medical emergency, we hope that that never happens, but if so, it's always important to have that on hand. So next we're going to talk about preparing the home. There's so many tips and tricks out there, and I do read through all the comments that you guys leave in your assessment at the end or the CEU form that you fill out, and there were some that I've added in here, so thank you for that. One easy thing that people can do, I mean, the world is your oyster when it comes to online tech devices and that sort of thing. Amazon is a great resource. You can purchase little door alarms that will chime if a door or window is opened. So that can be one way to keep tabs on if your loved one is moving in and out of the house. Some people have moved the lock on the door out of eye level. So instead of having a deadbolt right at eye level, perhaps there is a lock higher or lower, especially on doors that don't get used very often because, again, out of sight, out of mind. And then some even will place a cover on the doorknob to prevent their loved one from getting out. But I want to be very clear that it's important that the individual still needs to be able to exit the home in case of emergency. So if the loved one cannot get out of the house safely, then they really shouldn't be left alone at all in the first place. So be very cognizant of that when you're preparing the home for wandering. But another one that I think is always interesting, and I see this a lot in community settings, memory support types of settings, is a camouflaged exit. And in this particular picture, the third picture in it, that looks like a bookcase, but it's actually a door decal, which is kind of a unique way to disguise an exit of the house. So you can get a little bit creative here. And then for some people with dementia, a dark rug in front of a doorway will sometimes prohibit them from walking out, as does a big red stop sign. I mean, our whole lives we're taught when you see a red stop sign to stop. So a lot of times that will prevent them from exiting. So again, some easy ways to prepare the home. But what if, we have one more set of more slide on how to prepare the home. So you also, if your loved one is one that paces back and forth, if you're trying to create an environment that is safe for wandering, letting them blow off that steam or get the needed exercise, make sure that pathways throughout the home are safe. Also, think about installing a fence in the backyard area, and it could be even a smaller fence around a patio or something of that sort, especially during colder months of the year, to keep them closer to the home, but still allows them to wander about in a safe environment. Want to keep the hallways well lit, walkways well lit. And that can also help in guiding someone to the restroom during the night, for instance. So we want to make sure that there are no tripping hazards. The walkways are well lit so they can get around the home easily. And then, again, organize and track medications. A lot of times people with Alzheimer's and dementia have a complex medical or a medicine regime. And sometimes if they are not properly taking their medication, then their behavioral symptoms can change. So we want to make sure that they're taking their medication and that's well organized. And there is a great system called Simple Meds that can help with that if families are in need of a resource. And I'll share that on the resource slide here in a little bit. Finally, I want to talk about what if your loved one wanders. We've talked about being proactive, being preventative, but sometimes people do end up wandering, and it becomes a very serious issue. We talked about how 3 out of 5 people with Alzheimer's disease will wander. So even the best laid plans, even the best prepared families may find themselves in a bit of a panic after they've wandered away, their loved one has wandered away from home. So what do we do if we cannot locate them? Well, first things first is time is of the essence. Those who wander are often found within a half mile of their home or in the starting location of the incident. So first thing you want to do is to look in the house, especially areas like the closet or in the yard. And if you're still unable to locate them, then you want to try to think of clues as to where that person may have gone. For example, did they say that they wanted to go somewhere like the store, or were they talking about going home? Or does mom or dad have a favorite place nearby that they usually go to? So if you've been looking in all of the places around the home, if you're looking for more than 15 minutes, you need to stop the search and call 911. Because if a loved one's not found within 24 hours, he or she could be harmed. So families, we want to tell families, if your loved one wanders, spend no more than 15 minutes trying to search around the house or around the neighborhood before calling for help. And again, try to think of those clues even after calling 911, because when you do call law enforcement, they're going to ask for as many clues as possible. So after 15 minutes, you call 911, fill out a missing persons report, and make sure that law enforcement knows that the person who is missing has Alzheimer's disease or another form of dementia and is a vulnerable adult. In such cases, law enforcement does not typically require the 24-hour waiting period to look for a missing individual. And as I mentioned earlier, a lot of law enforcement agencies across the nation are tuning in to this wandering issue. A lot of states even have a silver alert that is a piece of legislation. It's kind of like the Amber Alert, where it helps get the word out about missing people. And then you'll want to provide a photo and, again, a medication list. Have that on hand in case you have to meet the individual at the hospital or whatnot. And again, having that most up-to-date photo can really help in expediting this search. And those questions that I had mentioned earlier that you're likely going to be asked is, when were they last seen? What were they wearing? Do they have a preferred nickname? That's one that sometimes family caregivers don't always think of, is if they have if their name is Robert, but they always go by Bob. We want to make sure that law enforcement knows that. Or maybe the nickname that they had as a kid, especially if they, in their mind, are living in a different time or place. And then you'll want to alert your network. I mentioned the Missing Senior Network. I wanted to bring it up again because it is a valuable tool. So you can either call or text your family and friends. You could use the Missing Senior Network to drive out that message. And you can also call the Alzheimer's Association's 24/7 helpline. And I give this Alzheimer's Association hotline number to families, especially when they're concerned that maybe law enforcement won't take them seriously in their community, because the association can help connect with the local law enforcement and communicate the importance or the immediacy needed to address the family's concern. So these are some great resources, but I do want to wrap up with a few more on the slide. I know I've thrown a lot of information out there to you, but there's some great family resources, business resources, and resources for law enforcement. So for those families that are a lot of families are on the go, maybe the caregiver is working. If they need an extra set of eyes and ears in the home because their loved one is wandering, you can always hire in outside help. You can find more information at homeinstead.com. That Missing Senior Network site is on there. Again, that's a free resource. And helpforalzheimersfamilies.com has some additional really nice articles and tips and resources on wandering. That medication management system I had mentioned earlier, there's simplemedsrx.com, is another great family resource. And then the Alzheimer's Association, alz.org. If family members want to learn more about the disease or get additional resources, that's a great one. That unmet needs chart, the emotional, physical, the other ones are escaping me, but that nice little graphic that helps people check in, okay, what is my loved one's unmet needs. That book, and a lot of the information you can find there on confidencetocare.com. Alzheimer's.gov is another great resource. And then the area agencies on aging in your local communities, you can find them at n4a.org. A lot of times they have some nice family resources as well. And then if you are a business owner or if you want to learn more about how your business can become Alzheimer's friendly, you can visit alzheimersfriendlybusiness.com or Dementia Friendly America. Dementia Friendly America is a neat organization that's trying to create more Alzheimer's friendly communities. And there's some really cool information there. So if you're interested in learning more, I think it would be great if every community was at least a little bit educated on the disease so that if they do see a community member wandering, that they can jump in and help. And then finally, law enforcement. Dementia Friendly America has an entire section on the law enforcement arena, or the first responders. And then that Project Far From Home, and then that Montgomery County Police Department, they have some really great resources on their site as well. So I want to leave you with all those resources, but just to recap, wandering is likely to occur. It's hard to say whether or not an individual will wander or how often they will wander, but if we can help family caregivers know the triggers, if we can help them be proactive, find patterns in the triggers, and be preventative, then hopefully we can reduce the number of news stories that we see or the number of social media posts that somebody has gone missing. So with that, I want to open it up for questions. So thank you so much, everyone, for tuning in.
All right. Thank you, Lakeland. Great presentation. Really important information on a very important topic. Yes, everyone, it is time for the Q&A portion, so send in your questions now, and we will get to them. The first question here, Lakeland. Earlier, you were talking about a potential cause for wandering is the unmet needs. You were talking about that earlier on. So do you have any insight on what might be some effective ways to find those unmet needs, how to address them?
Yeah, that's a good question. So those unmet needs are, again, going to vary for each person with Alzheimer's and dementia. And for a lot of people, when their needs are unmet when they have dementia, it usually results in some sort of agitation or they might start to get upset. So that's kind of a good first indicator. But again, it's going to affect everyone differently. I would suggest that this individual visit the confidence2care.com site because the book dives in deeper about all of those unmet needs and how to recognize them, and then strategies on how to address them. So whether it's redirecting them to a different activity or finding a new way to help them communicate their need. For instance, if they can't tell you, maybe they can show you, those types of things. So you could say, well, can you show me what you're looking for? Can you help me find it? Let's find it together. Those types of tips, while they may seem kind of basic, they can really make a big difference. So I would direct you to confidence2care.com for some additional information. But it is challenging because it affects everyone differently. But families, if they start to recognize those times of day or patterns in their loved one's behavior, then you can hopefully associate that with an unmet need. And then when you're able to meet the need, hopefully you'll see a change and the agitation will go away or the irritation will go away. So that's a good question.
Okay, Lakeland, next question. A lot of folks probably at this stage might not be driving still, so they might not actually have a driver's license anymore. So for folks who don't have a picture ID like that, what other options are there for people who are in that situation?
That's a great question. I know that most states will issue a state ID card. It's not a driver's license, but it is a state ID card, so you can look into that. And if that's not an option, if the person is always carrying, a wallet, that sort of a thing, you could create kind of your own ID card or slip the caregiver's business card in there, something of that sort, or label the clothing. So if they have a jacket, a favorite jacket that they wear, or a couple pairs of pants that they're typically wearing, a couple shirts, label those items with their name and their name, the caregiver's name, and the phone number. But also the Alzheimer's Association's I want to get back to my slide here. The Medi Alert and Safe Return Program, those bracelets are nice. So if the loved one is willing to wear a bracelet or a necklace, then that information can be on there. So those would be the suggestions. And I did forget to mention that a lot of people do have cell phones nowadays. So if your loved one does have a cell phone, make sure that that cell phone is always charged, because that phone can kind of be used as a tracking device. And there also are some tracking devices that families might want to use, especially if their loved one is a frequent wanderer. And they're ones that you can place in the person's shoe, and that can go pretty well undetected by the person with dementia, but can help the family locate their loved one sooner. And if the loved one does have a cell phone, if the family caregiver can be an administrator on the account, or if they can set up the Find My Phone app, that can really help in, again, speeding up the process of locating the individual. So that was a very long answer to a very simple question, but I would look first to see if there's a state ID that's available in your area that the person can get.
Okay. Lakeland, can you talk a little bit more about the strategy of redirecting that you were talking about earlier? We have a question about someone saying, my loved one would get physically abusive when trying to elope or wander. So what other strategies can we implement for redirecting?
Yeah, that's a tough one, and I'm sorry that you're having to deal with that. That can sometimes be frightening for the caregiver, especially if the person becomes combative. Redirecting is a tactic that you can use to, it really is what it sounds like, redirect their attention to an activity that they enjoy doing. So if you know, perhaps it's a gentleman and he was an avid golfer, perhaps when he's getting angry or combative, you could redirect him to an activity that he loves. I'm not saying give him a golf club, not at all, but maybe you could say, oh, I think golf is on. Should we go in and watch it together? Redirect him to another activity. Or if you knew that a woman used to be a stay-at-home mom or a really good cook, perhaps you could say, if you're seeing them getting agitated or upset, you could say, would you mind come helping me in the kitchen? I really could use your help, and get their mind off of whatever is making them upset or agitated. But in some cases, when there is somebody being combative or angry, if the person is in a safe environment, sometimes the best thing to do is just walk away for a few minutes, let the person settle down, and then the caregiver should reapproach the individual with kind of a chipper demeanor and act like really nothing has happened. So instead of coming back in and saying, oh my gosh, why were you so upset? It's going to just rile them up again. So take that opportunity, walk away for a few minutes, come back and say, hey, Joe, I saw that the golf game was on. Do you want to go watch it together? So again, just trying to get their mind off of whatever was upsetting them or causing that agitation. But there's so many other great tips out there. So I definitely would encourage you to visit helpforalzheimersfamilies.com, the Alzheimer's Association's website, and that Confidence to Care book, because those 3 sites will have a whole host of other suggestions out there for you. But that's a good question, and I hope that it helps.
Okay, well, Lakeland, we are just about out of time here. Unfortunately, we've got to wrap up for the hour, but I want to thank you for a great presentation and for joining us today. This really important topic. Thank you very much.
Thank you. Have a great day, everyone.